Madam President.
Senator from California is recognized.
Madam President, I'm proud to follow my colleague from New Jersey, and I am proud to say that I am a co-sponsor of your bill and Senator Udall's bill, the Murray-Udall bill, that is going to make sure that we protect the health of our families. Madam President, I'm going to put up, and I should say, Mr. President, I'm going to put up a beautiful photograph here of the Supreme Court, where above the portico, these words are inscribed: equal justice under law, and we've reprinted them up here. And I'm going to keep this up for the remainder of my remarks, because I think that is the essential issue before us. Those 4 words are the promise of our country, that every American should be treated equally, should be respected, should be honored. And I would like to note that these words don't say equal justice under law except for women. It doesn't say equal justice under law except for birth control. It doesn't say equal justice under law unless it's okay with your boss. The beauty of this nation, Mr. President, is that we respect each other's rights and freedoms, and we've shed blood to make sure that those freedoms are protected. And yet, with this Hobby Lobby ruling, 5 men who happened to be appointed by Republicans decided that a corporation has the power to deny me or to deny you coverage of critical health care for us and for our families. And what is really upsetting to me is that they seized on the Religious Freedom Restoration Act of 1993 to justify giving for-profit companies the sweeping power to deny their employees access to affordable birth control, and we believe it will prove to be other health care benefits required under federal law. Now, I want to speak as someone who voted for the Kennedy bill, the Religious Freedom Restoration Act. If anybody thinks that Ted Kennedy wanted to deny access for birth control, then they didn't know Ted Kennedy, and they didn't read at all the record as we debated that bill. So I voted for the Religious Freedom Restoration Act because it was written to protect an individual's freedom of religion, an individual's freedom of religion. So that if I, as a religious individual working for a corporation, don't want to use the birth control coverage, I don't have to. But if I want to, I make that choice. If I, as an independent individual, want to vaccinate my child, it's covered under law, under the insurance, I can. If I don't want to, no one can force me to do that. So the idea behind the Religious Freedom Restoration Act was to protect the individual. And I'll read from it. Quote, "Government shall not substantially burden a person's exercise of religion." Let me repeat, a person's exercise of religion. It didn't say a corporation's exercise of religion, your boss's exercise of his religion. It was about protecting the individual. And what the conservative majority of the court did 2 weeks ago turned the Religious Freedom Restoration Act on its head. And as someone who supported that act, it made me angry, sad. Put in the adjective. It's wrong to reinterpret what a law meant. It stood the Religious Freedom Act on its head. And they ruled that a corporation could put its own ideology ahead of the religious freedom and health care needs of its employees. Now, a female employee should be able to decide whether to use birth control. And that's not all that's at stake after the Hobby Lobby decision. Because we know, if you follow their logic, that a corporation can deny birth control because of a religious objection, what if they object to a blood transfusion? There are certain religions that do. Then the employee can't get a blood transfusion. And what if they object to a vaccine or HIV treatment? Then, in order for employees to have access to those treatments, they wouldn't have the insurance. And we all know from looking at the real world, if you don't have insurance, these treatments become very, very expensive, and you may not be able to avail yourselves of them. Now, Chief Justice John Roberts, during oral arguments in the Hobby Lobby case, made it clear that Congress can fix this and override the court's decision, and I agree. And that is why I'm so thankful to Senator Murray and Senator Udall for working so hard and so fast that we can have a remedy right now. And it's important that we act fast. People, Mr. President, are very confused out there as to what they can count on in their insurance coverage. And so we're going to have a vote on this tomorrow. It's a cloture vote to end debate so we can actually get to a vote on the substance. And sadly, it means we need 60 votes, a supermajority. But I hope and frankly pray that we get those 60 votes because we need to protect women's health. Now, the bill, the Murray-Udall bill, is called the Protect Women's Health from Corporate Interference Act. But they have nicknamed it Not My Boss's Business Act, which I like. It's not my boss's business, what I decide to do. And it would require employers to follow the federal law when offering health insurance to their employees, notwithstanding the Religious Freedom Restoration Act, which, as I said, I believe the court stood on its head. It was meant to protect individuals, not corporations, not your boss. So the bill says corporations can't hide behind the Religious Freedom Restoration Act to deny their workers coverage to the benefits that we have in law. Now, more than 180 House and Senate lawmakers have co-sponsored this bill so far, and I hope our colleagues will vote for it. So I was saying that we need to act fast because there's confusion out there, and virtually so many women rely on birth control at some point in their lives. It's amazing. 60% of women who take birth control, 6.5 million American women, do so in part or in whole to treat painful and difficult medical conditions. So let me say that again. You take a birth control pill for birth control, but there are many other uses for that pill. 1.5 million women out of the 6.5 who use it, at least in part for other conditions, use it solely as a medication to treat those painful and difficult conditions. Now, by allowing employers to deny coverage for contraception, the court is depriving many women and families of health care. Surveys have shown that 55% of young women age 18 to 34 struggle to afford birth control, which can cost up to $600 a year. Now, maybe the Supreme Court justices in their ivory tower think that's not a lot of money, but let me tell you, for women working the minimum wage, even for women earning more than the minimum wage, it is quite a hit to their pocketbooks. Now, Ruth Bader Ginsburg pointed out in her dissent that a woman earning the minimum wage would spend nearly an entire month's wage to get an IUD. $1,000. Imagine. This case has unjustly singled out women's health services. Now, I have to make a note here. I do not know of any employer that is dropping coverage for Viagra. I don't. I've asked around, I've been on TV, I've invited folks to let me know. Oh no, Viagra's fine. Birth control's not fine. And just put the pieces together yourself. I think that this decision discriminates against women. And in the slippery slope argument, you're going to see it affect everyone. And we need to listen to the women who rely on birth control to improve their health and the health of their families. Let me tell you a few stories. Raquel from Sacramento was diagnosed with non-Hodgkin's lymphoma in 2010. After her treatment, Her doctors told her she needed to use birth control to ensure she did not become pregnant for the next 3 years because she was really sick. Luckily, her employer covers birth control, and now, happily, 4 years later, she is pregnant with her first child. What could have happened to her if she had gone through an unintended pregnancy? Could have been pretty devastating. And what if she had worked for a different employer who refused to offer her that birth control? Her health and the health of her child would have been at risk, and that would have been tragic. So let's listen to her, and let's listen to Catherine from Pleasant Hill, California, who relies on birth control after having her first child. She says, quote, "Both my husband and I want to be the best possible parents for our son, and having another child so soon would hurt our ability to do that. A variety of affordable birth control options, those are crucial for me and for all first-time moms like me." Many, many, many years ago, I was on the board of Planned Parenthood. And what we said all the time is our dream was that every child be a wanted child. A wanted child. And as a parent myself and as a grandparent, I'll tell you right now, it takes a lot to raise a child. Hillary Clinton said it takes a village. It certainly takes loving parents. And it takes a loving family. And it certainly costs money. And it certainly takes energy. We want our families to be healthy. We want our families to be productive. And birth control is a success story. And it breaks my heart that women just like Catherine, who work at Hobby Lobby and other non-for-profit corporations, now could be denied access to affordable health care unless we fix this. The Religious Freedom Restoration Act was not about handing your boss the power over you like this. It was about giving you the right to make your own choices and decisions. Now, Ariana in Reading wrote, quote, "I'm a recent college graduate trying to make ends meet and pay off my student loans. It is a great relief to know I can get the birth control I need without a copay." These are real stories. Now, if the boss doesn't like it that you choose birth control, that's his right. If he wants to sit down with his daughter and tell her his religious objection, and if she agrees with him, that's fine. I mean, that's what America's about. But don't take your religious beliefs, your ideology, your biases, your prejudices, and your opinions and foist them on your employee. That is not this country. That's not what we're about. Shouldn't we care more about the rights of women and their families than the rights of a few employers who can exercise them in their families? I mean, really, this bill that we're going to vote on is critical, and I hope it won't die as a result of partisanship. We have to rise above partisanship around here. Equal justice under law, that's what it says over the portico. And, you know, frankly, there's another issue. If you look at what has happened to the rates of abortion since we have seen more use of birth control, they're going down. What is the exact amount?
A study says over 50%. One study says.
In the last how many years?
In a sample in St. Louis shows.
There's been a study in one of our nation's big cities that proved that because there was broad use of birth control, abortions went down by 50%. Imagine. So if that's our concern, regardless whether we're pro-choice or not, we shouldn't be embracing decisions that make it more difficult for women to get access to birth control. So, equal justice under law, it doesn't say except for women, it doesn't say except if my boss disagrees with me. It's pretty beautiful. It's pretty clear. It's something that we have to respect. It's for the ages. And tomorrow, we're going to see if our colleagues agree. Every senator must take a stand tomorrow for individual liberty. And when we vote tomorrow, let's be reminded, women are watching. The American people will hold each of us accountable if we fail to protect their rights and their ability to decide what's best for their families. I've been around a while. I was around when one of the Bushes actually was on the board of Planned Parenthood, George Herbert Walker Bush. Suddenly this issue is back, birth control, and suddenly we're arguing over it again. So let's say this. I may be wearing a white jacket, but it's not a white doctor's coat. I'm not a doctor, and I don't want to put myself as a politician in between a woman and her doctor, or in between a family and their doctor. Let's leave important healthcare choices where they belong, with women, with families, with doctors, not with politicians in the Senate or justices sitting in a court somewhere. Thank you very much. I yield the floor.